All right, let's re pick up where we left off. We are starting now, chapter 4, performing an EKG. So before we even perform an EKG on anyone, remember the EKG is a snapshot picture of the electrical conduction of the heart at that particular moment. So anything can happen after that, or could have happened before. So what you're going to be doing is taking a snapshot using 10 cameras, 10 wires or lead wires, and take a picture of the different sides of the heart. Okay, so again, remember that if you use looking at the heart, you're gonna be looking at it with 10 different views, right? Everybody has a camera and is taking snapshots from here, from this side, right? AVF down here, AVR, EVL. So you have your limb leads and then your augmented leads, all looking at the heart from different angles. And also you're gonna have your chest leads, which look at the heart straight through. Okay, you have V1 through V6 looking at the heart from all the center, right in the middle, and then to the left side, all the way to this part. Okay, where V6 would be located at. So that's what you're going to be doing with a 12 lead EKG. Using 10 wires, you're going to create 12 pictures of the heart. But before that, you remember you have to have an order. Not just anyone can order an EKG. Usually, it's going to be your primary physician, your doctor. It could be part of your wellness check, maybe once a year. Again, anyone over 40 is recommended to get an EKG because it gives you at least a baseline. 40 years old, your heart is completely should be pretty healthy overall. Okay, the electrical conduction system should work completely normal. So 5, 10 years from there, when you're 50 and you start to feel a little bit, aged, and your heart feels a little aged too, you may obtain another one. Well, by this time, you should have already 10 because it's once a year. Again, this is your wellness check. There's nothing wrong with you. So the doctor, your primary physician, will make it part of your record. It's going to be on there for you to view, and he may actually see small subtle changes. And if you have any symptoms, then these will correlate with your EKG. So your primary physician can order it. A nurse practitioner can order an EKG. A physician assistant can order an EKG. A specialist such as a pulmonologist, a cardiologist, of course, can and write a prescription for an EKG. Now, why do you need a healthcare provider to order it? Well, because insurances pay for it. And if there is no order, then insurances will not pay for it. So it's part of the documentation that companies, the billing, right? When you submit your bill to the insurance company, says, well, I need y'all to pay me because we did an EKG on Mr. Reyes, and there's a prescription, there's a copy of the EKG or whatever, the interpretation. Remember, part of the process, not just doing the EKG itself, but it's also has to be interpreted by the physician. So that that skill is only the doctor can do it, right? They're certified to do that, to interpret EKGs. Even though the machine says it's a completely normal EKG, there might be little subtle changes that the machine does not pick up, and the doctor can correlate it, all that. So it's part of the interpretation that is also the cost for having an EKG done in a doctor's office. It could also be ordered, remember, for pre-surgical clearance. If usually people that are older or even younger people, you'll have an EKG done before you go to surgery. If you have any symptoms, if you ever feel sick, tired, weak, or the doctor feels that you may need an EKG, because usually we don't suspect young people to have cardiac problems, but if something might have happened or happens to you, is happening to you, and the EKG may actually reveal some of those problems. So again, it's part of the what we call the workup, cardiac workup on a person that may be going to surgery, or just as a wellness check, part of their overall medical record. So what information do we need in the uh, in the chart? Obviously, we need their name, the location where the procedure is being performed, the date, the time, the age is very important. There's sex identity, the male, female, their gender. I'm sorry, not the gender, but the race. It also matters because, as we know, different races tend to have more cardiac problems than others. Like African Americans have higher incidence of hypertension, heart disease, and so on, followed by Latinos, Hispanics, and then whites. and it's mainly diet for the most part. Any special conditions that the physician requires or positions, maybe the person is in a contracted position like this, and you're like, okay, how am I going to perform an EKG on someone that's like this? You know, there's a special procedure for that. You put the wires in the back, but we'll go into that later. So, anyways, the height and weight of the person is important. Any medications that they're taking, that is very important. You need to document what medications they're taking, right? Just make a list, because if there is any abnormal findings in the EKG, they may be justified with medications. So please make sure you get all that information into the requisition before the procedure is done. All right, so the room has to be prepared before you bring in the patient. Hopefully, the room is as electrical current free as possible. Any non-essential devices should be disconnected from the wall. Any mobile devices, anything that conducts electricity has to be either turned off or removed from the room to minimize the amount of electrical noise or artifact that we call. Make it comfortable for the room. Obviously, it has to be, cleaned out, and uh, paper, disposable, papers or liners that are placed on the beds and so on. All this has to be in place. Okay, so I want you all to view a quick video on the procedure itself so that you can have a good idea of how you're going to be performing the procedure on each other next time we meet. So I'm going to share a screen with you, which is going to show you the video if you haven't seen it already. Okay, so here it goes.
Hi there, I'm David. I'm one of the medical students. Thanks for coming in today. Can I just confirm your name and date of birth?
Sure, it's James Alexander, 13th of December, 1989.
Okay, James. I'd like to do an ECG today. It's an electrical tracing of your heart. It's going to involve me placing some sticky pads on your chest, arms and legs and measuring the electrical activity of your heart. Would that be okay?
Yeah, that sounds fine.
For this, I'm going to need you to take your top off and just lie down on the couch for me. Is that okay? Are you comfortable where you are?
Yes, I am.
Do you have any pain in your chest at all? Okay, I'm just going to start by feeling on your chest to work out where to put these leads. Okay. I'm just going to place some sticky pads on. So if you just relax your hands flat for me, just on the side, that's great, thank you. Just going to put some sticky pads on your wrist. And on your ankles as well. Okay, that's done. Thank you very much, James. I'm just going to take the leads off.
Okay, so that was a short video, and the link is there on the website, so you can view it once again if you'd like to. But it's very simple, very straightforward. As you can see, the procedure itself is very simple. It probably the most challenging part of it is to be able to place the electrodes in the correct place by following the landmarks, and we went over that earlier. So on page 87 of your book, you'll notice that you have all the different landmarks that you have to be familiar with. The midclavicular line, the intercostal spaces, the anterior axillary, and the mid axillary line. All right. So make sure you kind of palpate yourself. Right. Find your clavicle right here, and then if you palpate in the middle, you have to be a little firm. Okay. If it's hard, that means that's your bone. All right. Clavicle here. So then you have first intercostal space. Put the next finger on there, and then palpate for the next space, and so on. You go into the until you find the fourth intercostal space on the right side, which is V1. Left, right across from it is V2, and so on. So please palpate, practice with yourself. If you have someone at home that you can practice on, it has to be usually a larger, if it's a child, a little bit larger, maybe 10 or 8-year old, a big child, or an adult. If you have someone at home you can practice with, palpating, because it's not easy, especially when sometimes we have more adipose tissue, we have a little bit more fat around this area. And see, other women, we'll talk about performing it on the females. When you're going to be placing V4, 5, and 6, which are right here around, right below the nipple area to this line, okay? If the female has large breast, you're going to have to lift the breast or ask the patient to lift their breast, and you're going to place the wires on the respective landmarks, okay? So you cannot put the electrode on top of the breast. It's not going to work because the uh, the breast tissue does not conduct electricity the same. So it's not going to be, so you want it as close to the skin, to the bone as possible, so that you can get a good electrical flow. So again, look at those landmarks, be familiar with them so that you are able to locate them and place the electrodes in the correct place. Now on the video, he did talk about different colors of the lead wires. Don't worry about that. That video seemed to be from in Europe, so sometimes they use different colors, different measurements. Here in the United States, we're going to use the colors that we talked about, right? The salt and the pepper, the lead is the green, and then the red on the left, and then all the brown ones are going to be in the chest. So we'll look at that in here when you come here. So make sure you're safe, and take any safety measures for yourself and for the patients. Safety includes obviously putting the brakes on the bed or stretcher, wherever you're placing the patient. Make sure that the resident or patient does not fall off the bed or the gurney or stretcher, whatever. Make sure that all that safety measures are put in place. Infection control, as you saw, you have to disinfect your hands before and after you have contact. Uh, Preferably, obviously, use gloves, especially now with the pandemic going on. We have to take extra precautions and use gloves. Everything has to be sanitized before a new patient comes in, and after, obviously. So once it's sanitized using approved disinfectants so everything is disinfected. Everyone has now, with the pandemic, obviously the patients have to wear a face mask, a mouth, whatever, a face mask, so that bacteria not spread. So take all those safety precautions, infection control measures. If you're going to in a hospital, if you're going into a room that the patient has a specific bacteria that is transmitted, either airborne or droplet or contact, you have to take those extra precautions. You might have to wear a gown and gloves for someone who's in contact. You might have to wear the N95 for someone who's in airborne. The equipment itself may have to be covered completely before taking it into the room, and probably disinfect it afterwards according to the guidelines or policy of the facility. So please be familiar with those specific guidelines, because every facility may have different measures. So again, please make sure you follow those isolation precautions for airborne droplet contact. Okay, so maintain safety during EKG. The grounding, the wires, all three wires, usually here in the United States, they have a third. It's like a pin. There's two, and then there's one prong. That prong is what we call the ground. So any equipment that you use has to have a ground in case there's an electrical um, shock. The electricity will be dispersed into the ground instead of shocking someone. That is the point. Plug in the machine securely. Ensure that the power cord insulation is intact. There's no frayed cords or anything like that. If there's any contact with the bed, the patient can get electrocuted. Raise the bed to a working height and return it to the low once you're done. Any perform any hand hygiene. I use good body mechanics again. If the person requires assistance to get onto the bed or the stretcher, whatever it is that you're using, please make sure that use good body mechanics. Make sure they don't fall, especially if they're elderly. Sometimes we work a lot with elderly people or older adults, and we have to take extra precautions. Do not allow them get off the bed on their socks. Make sure they have the shoes on before they start walking because they will fall. They'll slip and they'll fall, and that's the last thing you need. With a simple procedure like this. Does anyone have any questions at to this point? Palpate the mannequin and practice palpating the landmarks. Then you're going to be placing the electrodes, and then the wires. I want every one of you to tell me, the different colors and the leads and the views. I'm going to be quizzing you on that, so make sure you feel comfortable doing that because I will quiz you, and that's for all of us to learn. Okay, so everybody's going to, just do a verbal quiz. Show me where lead one, where the electricity of lead one goes to. What direction? Well, from right to left. Okay, good. Show me where the electricity of lead two goes to. Well, from right to left leg. Okay, very good. Lead three, and so on. So that's what I want you to do. Also, I want you to know the views of the heart. Okay, if you're looking at lead two, what part of the heart are you looking at? What picture is it? I want you to understand that. If you don't, then you need to ask, and so on. So make sure you get familiar with the operating the machine. Again, I said there is links and videos there specific to the machine that we have here, so that you can be a little bit more familiar with it. You must have enough EKG paper inside the machine. The last thing you want to do is run out of paper when right in the middle of the procedure. So please make sure you're gonna need alcohol swabs because you may be or you will have to clean the skin where you're gonna place the electrodes, because remember the skin has oil, and all that oil may affect the way the connection or the contact between the electrode and the skin, and you will have a poor um, results. Actually, that's one of the most common problems that I see here is that if you don't clean it correctly or clean it really, really good, like scrub the area, maybe not irritated, but clean it where there's no more oil. When you put the electrode on there, you're going to notice that sometimes you're going to have a poor signal. The AKG is going to look completely messy. Why? Because the electrode is probably falling off or it's not attached correctly. And sometimes you have to go back and redo it. And that is probably the most common problem that I see. Electrodes not being put on correctly because they're not sticking. And the other thing that I don't know if you noticed, but when they put the electrodes on the wrist area, we want to put it, the electrode, the sticky. I should have brought one. You want to put the tab, right? It's square and it's got like a little tab where you're gonna attach the electrode, right? So you're gonna put it where there's no hair. You don't want to put it on the arm if the person has hairy arms. You want to put an area where there's no hair, and the electrode has to be pointing down. If the clip is going to come this way, you want the little tab to be facing the clip. Okay, you don't want to put it facing this way, and the alligator clip is going to come this way. It's going to be twisted and it's going to be pulling on the tab. So that's what you don't want. I'll bring a tab in just a minute. So again, make sure that you're not the wires are not pulling on the tab where it's twisting, coming off, things like that. So make sure that you place them on correctly. That's probably one of the most common problems that I see as well. So I want you all to get familiar with that, and we're going to be doing that on Friday. All right, check
Sir, I
the,
have a question.
yes.
I have a question that came out on the quiz or the test, I don't remember.
Mhm.
That if the sticky pads were like from a different company, like if one of them was from a different company, that
Mhm.
if you continue or do you get them like all the same?
Preferably all the same. You want them all to be the same. You don't want to use a set, different ones because you might get a very strange looking EKG. Always try to use the same ones. So make sure you perform good skin prep. Use new electrodes, and those electrodes, guys, the ones that you stick on, those actually expire. They actually expire because once you open a package, and if you open it, you have to make sure they close it really good because if you don't, they dry up. I'm going to show you, excuse me, an example of some old ones that I had here, and I kept them for the reason so you can see that they're dry and they're old and they're not going to conduct electricity the way they should. So you're going to have a poor looking EKG. So make sure the electrodes are not dried, and you can see some of the gel. Ensure that the patient is not touching the frame of the bed or side rail because obviously metal conducts electricity, and anything, including their own mobile devices, can conduct an electrical current. Always check the insulation of the lead wires. Ensure that there's no stress on the lead wires, like they're like pulling, they're tugging on the electrodes, because that will give you a very poor looking ECG. What is artifact? We said that this is uh, electrical noise, right? I'm going to share with you the pictures of artifact. Oops, I think I went too fast. See the picture of this machine? This is exactly the one that I have here. Okay, this is, we call the module. And then you got your wires that attach to the module. This module is attached to the machine. This connects here. And then you can see the monitor and the keypads right here. This is like the ones that I have. They're called alligator clips, and they're going to be clinging on to the electrodes. But I want to, okay, this is where there's different kinds of artifact that you're going to be dealing with. Where is it? I'm on page 96. Okay. Here it is. Y'all can see that, right? There's different kinds of things that can give you a very bad looking EKG, and usually this is what you see as soon as you put the wires on. You're going to see this wandering baseline. The EKG is going to be going all over the place. Okay. What is one of the main problems? Too loose or incorrect electrode application. That's the main problem. Tension or pulling on the electrode. That's one of the most common problems that I see. Too little electrode or gel solution. That's because it's probably they're old or expired or dried out. Uh, Oil, lotion, dirt on the skin because we didn't, go do skin prep. Poor or no skin prep. This is very, very common. You're probably going to see this when you practice here. Okay, the wandering baseline. How do you correct that? Apply the electrode securely. Make sure that the entire surface of the skin is making contact with the electrode. Remove any tension. Again, if the clips are pulling on the electrode, make sure that's not the case. And use new disposable electrodes and store unused ones in a sealed plastic bag to avoid them from drying out. So this is probably the most common thing that you're going to see, followed by the next problem: AC or electrical current interference. Now, sometimes it is AC or alternating current interference. We see this a lot. You see how these squiggly lines, all these black marks, all you see is the R wave. Okay, you want to make sure you see the P, Q, R, S, T, and all that. This is not good, obviously. You cannot, that's just what we call noise or artifact. What can we do to correct some of this? What can you do? Can we correct it? We talked about it in chapter 3. Okay, yeah.
Adjust it.
I'm sorry?
You adjust it.
What can we adjust? There is a setting, right? Which setting?
The gain.
The gain would be correct. That's correct. You can increase the gain. You can increase the gain to reduce the amount of electrical interference, such as this. Okay, this is what we can do to correct, okay, this problem. We can try it. If we get this problem, when you perform one of them, you can try and correct it by moving the gain. Ensure that the plug has 3 prongs again. The plug on the machine has 3 prongs, which it does, so we don't have to worry about that. Wait until any other procedure is done. Reposition the lead wires to ensure that they follow limbs and are pointed in the proper direction. Move the patient's bed away from the wall. Okay. What's another problem that you might see? Flat line tracing.
The speed.
The speed or somatic tremors. I don't think I spoke about somatic tremors. Somatic tremors are soma means body. Okay, soma means body. So body tremors. If the person is cold, shivering, they're nervous, that's gonna give you some of this, very fine, um, uh, you know, little black linings, and we don't want that. If you see the person that they're shaking, obviously they need to be kept warm. Maybe put a blanket on them. Especially if you're gonna undress their top part, they're gonna be cold. So we have to handle that with caution. Body tremors, it's movement of the muscles, okay? And then it's controlled, and all the muscles create electricity, and it's going to give you a very weird looking EKG. So look at the person. If they're shaking, shivering, that's because they're cold and they have all these tremors. You don't want that. You have to make sure to eliminate that. The flatline tracing, if you ever have a flatline tracing like this and the person is well and alive, obviously you cannot, this is unacceptable. You have to fix it. Okay. If there's a flat line without deflections occurs during the tracing, it could be asystole. A means without, systole means contraction. So the person's heart is not beating, or is it beating? If the person is alive, obviously something is wrong with your wires or with your machine. You have to troubleshoot it. But if the person is not breathing, they're turning pale, they look kind of like dead, or they're dying, obviously this is a problem. This is asystole, means there is no electrical activity in the heart. This is what you see on a dead body. Okay, there is zero electrical, and that's how we pronounce someone that is clinically dead, with there is no electrical flow. And you can check in more than one lead. You check in lead one, lead two. You can switch them, and then you know for sure that the person is clinically dead. The heart has no electrical flow. Um, what other problems may you encounter? Well, we talked about the artifact, the wonder baseline. So again, most of the other problems have to deal with, with the gels, with the electrodes, the cleaning, the prepping, and all that. Those are the most common problems that you'd be dealing with. Reporting EKG results. Now, it's not your duty, it's not your scope, your responsibility to give the results to the person. The machine's going to give you results. It's going to be right there. It's going to tell you normal, abnormal, or this or that. It's not in your scope of practice to give the results of the person. The only one that can give the results or interpret the EKG is the physician, the prescriber, whoever ordered the procedure. So please abstain from reading out results. Okay. uh, People are very inquiring. They're going to ask you, well, is there something wrong, should I be worried? Just go ahead. You're going to have to talk to your provider about that, the results, whether they're good or not good. But never even mention it. Well, there's nothing wrong. It's okay. You don't know that. So please, again, refrain from uh, referring about any results to the people, to the patients. After you perform the procedure, obviously you have to clean the machine with appropriate disinfectants. Not every disinfectant can be used on electrical equipment, so it has to be specific disinfectants. Otherwise, you will damage the machine. Pediatrics, pediatric EKGs on page 102. You have to prepare the child. Obviously, the child is going to be afraid, nervous, and uncooperative. Usually, what we try to do is, use other methods like a teddy bear. We put electrodes on the teddy bear, or a doll or something like that, so they can see that they're harmless. But kids are afraid. They're afraid of nurses. You see white coats and doctors, and they're afraid. So that's why sometimes in pediatric places you see the staff wearing uniforms with stickies and cartoons and all these things to make the child or children a little bit more at ease, so they don't get all nervous. Of course, you have to get consent from the parents, and instruct the child, right, in their own level of understanding. We're going to put some stickers on you and all this, and so that they can feel a little bit more at ease and understand what's about to go on. So what is the difference in an EKG? The only difference is that when a V3, their chest is much smaller, obviously, than an adult. So instead of putting V1, V2, V3, V4 like that, the only one that we change is V3. V3 goes on the right, okay, intercostal space, on the right side of the chest, to prevent it from crowding. Now, the child's chest is usually a little smaller. It's a little smaller, usually, the size of their fist. So V3 is fine to be go on the right side, right below V2, below and to the right. So V1, V3, and then V2, 4, 5, and 6. That is the only difference that you have to make, the adjustment that you have to make when doing an EKG on a child, right? V1, V3, 2, 4, 5, and 6. And of course, the challenging part is to actually get the child to cooperate and stay still. Remember, you don't want a messy EKG unless the child is completely cooperative. Can stay calm and without move, and have the parents sit with them and keep them as calm as possible. You can imagine if you have children, they're afraid of anything has to do with doctors and nurses. Now, cardiac monitoring, when somebody has to be monitored on a regular basis, the EKG, the 12 lead EKG, is not the best method of doing it. So for this reason, they use other measures, other devices to monitor someone on a continuous basis. So they'll place a telemetry monitor, or tele means television or video, okay? They're going to be monitored on a machine in some area, somewhere in the emergency room, or somewhere in a special cardiac unit. They're going to be monitored on a regular basis. And this is where we use the silver electrodes. When they're doing telemonitory, you don't use 10 wires. Okay, in this case, we usually only use 3 wires. We're going to be using the white, the black, and the red. Okay, white, salt and pepper, and then the red. So it's 3 wires going to be producing 3 views of the heart, and that's for telemonitoring, when the person has to be monitored on a regular basis. Usually, when they're in the hospital, that's what they have done. If they have history of any cardiac problems at all, they're going to have to be monitored on a regular basis. The white cable, usually the right arm, the black cable, usually on the left arm, and the red cable, uh, usually going to be on the left leg location. Usually put it somewhere on the lower abdomen, not on the leg itself. So it'll be salt and pepper, and then ketchup, usually on the left lower abdomen. So you have the triangle, all right? Eidhoven's triangle. That's what you want. Special considerations. There, I have, in my 20 years of experience, I've only had one person with what they call dextrocardia. Dextrocardia. This means that the person has the heart pointing on the wrong direction. So everybody's heart, can you all see the heart, or are y'all looking, you can only see the screen I'm sharing? There you go. So that's more or less what the heart is located, right? Below, behind your sternum, the breastbone, it's tilted this way, a little bit towards the left, okay? Towards the left side. So it's pumping right now, right? It's pumping, contracting. And what is the problem with dextrocardia? It says when the heart is on the opposite right side of the chest, it means that the heart is actually this cone, this part, instead of pointing to my left side, it's actually pointing to my right side, kind of like that. Well, I guess like that. So now it's pointing to my right side. I don't know if it's backwards on your screen, but okay, it means that the heart is on the right side. It means that the ventricle is pointing to the right side. So one time I saw this patient in their home, and I was listening to, assessing the patient, and I was listening to the heart and I couldn't really hear it. And then I could hear it, and then like, more this way. And I was like, I asked him if he had any heart problems, and then he told me that he was dextrocardia. He didn't even know it. Right? He grew up completely normal, except his heart was like this. So you have to make an adjustment to the EKG.
So then for that, sir, you would set up the wires like the opposite?
It's right here. If you look on page 105, 106. Yes, the opposite. Do you see page 106? If you're looking at it, there it goes. There it is. So yeah, the left ventricle, left atrium, and the aortic arch are located on the right side of the chest. So there you have V1. V1 is on the left side, like you said, in the opposite direction. V2 is on the right, and so on. Just like you were doing to the left, but now you're going to do it on the right side. So you're correct. The wires have, or the electrodes have to be placed on the opposite side, going this way to the right side of to the flank, right? Instead of going to the left. Now, we said, what if someone is in a contracted position or in a position where you cannot put the electrodes on the chest like you normally can? What do we do? Well, sometimes the doctors may order a posterior 12 lead EKG. A posterior 12 lead EKG. You look on figure 414, it tells you cables V1 through V6 are placed going from the patient's posterior left in order to the patient's posterior right. So it gives you the anatomical positions here of where the wires would go. This is the back side, okay? This is the back, and it tells you where V1 through V6 go, except we call them V7, 8, 9, 10, 11, like that, instead of going V1 through V6. So V1, or it's called V6 here, left posterior axillary line. Use cable V1. I don't know if you can tell the numbers, but they're on here. V6, right here. So this would be V1. V8 skip place at midpoint on a horizontal line between V7 and V9. So V8 we're going to skip, but it's going to go between V7 and V9. So that would be V2. V2 is V8 between V7 and V9. So we see V7 is over here and V9 is right here. So V8 would be right here. And so on. So again, these are rare. You don't really perform these very often, but they can be done. Say, for example, the person, I don't know, for some reason they have surgery on their chest. They can also order a posterior EKG, you would follow this setup right here on figure 414. All right, last thing I'm going to cover here is handling emergencies or cardiac or respiratory arrest. If a person that you're working with, you can see that they are getting very distressed, they're having trouble breathing, maybe complaining of chest pain, they start to get sweaty, you can rest assured they're going to have a heart attack. So always stay with the patients, always stay with them and call for help. Staying with the patient helps them stay calm so that they don't panic and make things worse for themselves. So you stay with them, call for help, and prepare to perform a CPR. I think most of you are already certified in CPR, basic life support, and if not, you will have to do the course at some point sooner than later. It is required for all healthcare professionals to be certified in basic life support or CLS. So cardiac or respiratory arrest, when the lungs, are stop working or the heart stops working or the heart stop and then the lungs stop, obviously we have to perform EKG. If a person has a seizure, right, in the middle of the procedure, obviously you stop the procedure and ensure the patient's safety. A seizure is a chaotic electrical activity in the brain, and the person sometimes they start convulsing. They start convulsing and they have huge tremors and shaking. You don't want to, obviously you're not going to get an EKG done. So at that point, you have to make sure that you ensure the safety of the patient first, before, above all. Otherwise, you're going to have more problems or complications. The EKG is going to have to wait because a person is having a seizure, and they can injure themselves if they're in a bed. They can injure their arms or hands. Remember, during a seizure, you never want to hold them down to the ground. Make sure you just kind of ensure that they don't hit themselves, or that you don't get injured either. Never stick anything inside the person's mouth. Never. I know a lot of people think that, well, the person's going to choke with their own tongue. That's impossible. That's not going to happen. Now they start to foam at the mouth, which is also very rare. Usually when the seizure is done, which doesn't shouldn't last more than a minute, we turn them on their side. So we have to provide help to the person after they had their seizure. Remind them where they are, what happened. If they have a moment of incontinence, then we have to provide some help with that. So there's more important things than the EKG at the moment. So please make sure that you feel comfortable providing assistance after the seizure. Usually we also want to write down the time the seizure started, and how long did it last. Sometimes it's hard to remember all that. It's like you're more concerned about the person. If it's your first time that you witness a seizure, like with convulsions and things like that, you might get scared. But try to note the times, like, yeah, okay, it's 9:48, and the person is safe. There's nothing they can injure themselves with. I'm not going to hold them down. I'm just going to let them have their seizure, and then help them out after that. So if it lasted 15 seconds, 20 seconds, or whatever, you have to remember that and write it down, because they will ask you. Sometimes patients will have more than one seizure. If they're having repetitive seizures, one after the other, that is considered an emergency. Sometimes some patients will have one seizure and it'll last 30 seconds and then that's it. And that's the end of it. They don't have to go to an emergency room. Nothing really happens unless they're older people that might have heart problems with seizures. Then you might want to send them to the emergency room. But there's a lot of people, young people, that have seizures and they have them all the time. Sometimes they're very, very mild seizures that they can't even, they have no problems, right? They don't have any problems. They just kind of like, it's kind of like a faint, like they just kind of pass out and then everything's gone. Everything comes back to normal. So again, seizures vary in the way they manifest themselves with people, but just know what to do. Stay calm, stay with the patient, ask for help, and be ready to perform uh, CPR in case of a cardiac arrest. I'm going to stop sharing this.